Okay, so you're live with APB. Today, Adam and Paddy, we're here to talk to you a little bit about an article that we read that was devised by Skills for Care, which outlines the cost, the true cost of recruitment within health and social care. And it's a very detailed look at the breakdown of exactly what adds and contributes to the overall cost of replacing somebody within health and social care. So I'll try and pull the article up. And hopefully that's come through. And basically, as you can see, as I scroll down this document, you can see that it's broken down by the different activities that take place through recruitment. It gives you some considerations and the examples. And the way that they've framed this is by looking over a 12-month period based on an organisation that's got 20 people with an average attrition rate of 33%, which was the average turnover of staff in 2017 when the report was done. So it works out at 6 people through a year for a 20 people organisation that they're losing. So just to give you some background, that you can see the example, and it's always divided by 6 to get the cost per person. So we'll just run through some of the attributing costs that lead us to the ultimate cost per recruitment, which is quite daunting actually. Paddy, do you want to just kick off there? So the first one that we've got, which is a considerable amount, is the cost of getting overtime in or using temporary workers.
Just that cover, when you have those vacancies, bringing other people in. I mean, there's a whole. I think one of the fascinating things about this was the hidden cost. Like you say, we'll get to that end number in the end. But I think there's so many hidden costs within recruitment that perhaps aren't identified. And really kind of where we'll go with some of this and some of this series is one of the things that we're really interested in is how do you improve that retention of people, right? So yes, that cover for existing staff as well as kind of people coming in to kind of cover vacancies. You also need coverage if you're bringing people in for interviews, right?
Yeah, and I think that's outlined somewhere further down. So we've got here the interview costs.
Yeah.
Having an interview panel, having senior people out of work, sitting on these panels, the assessment of CVs, it all costs. So they've got there the 20 hours of senior care, a senior care worker and a care worker in an interview panel is £438.
I think one of the interesting things here is as well, I think a lot of people I speak to that are engaged in kind of recruitment in organisations, they would like to have a more robust process, but finding the time is one of the challenges for them. So this is probably quite a conservative view on that in some respects.
100%. I thought that about a lot of the figures that are involved here. So if you look at that, so obviously these figures divided by 6. So for doing the actual interviews, doing the administration, liaising with the candidates, giving feedback internally as well to the business, they've got it per person at £125. And I think that is really, really erring on the side of a conservative figure from my experience.
Well, let's scroll us down, Adam, if you would. Let us have a look. What's that bottom number? What's it coming out at?
So it brings us out at a total of 3,600. Now, per person. The largest contributor you can see there is this 2,329, and where that's coming from is the amount of hours that existing staff are having to do whilst the new person is on probation, because they've said here that they approximate that that the new candidate is only operating at a 75% capacity. Meaning that other members of staff are picking up that slack, whether it's through paid overtime or not. The work has to be done by somebody, and it's obvious. You think about being new in a business or an organisation, with the best will in the world, you'll go away and try something after being shown once or twice. After you've done that time in shadowing somebody, which has obviously cost money as well, you're getting paid for just watching. But when you go and try something for the first time, by and large, you won't do it right. You might get close to it, but somebody then has to come and check the work, then they have to rectify, then you have to go and try it again. And it takes a long time of going through that process until eventually you're running on your own 2 feet and you don't need to have that secondary check, especially in an industry that is so sensitive around errors being made. So yeah, the lion's share is coming from operating at a 75% capacity, but only 2/3 of that.
And again, I think some of that might even be generous actually there, because, you know, for a lot of organizations, particularly if you're working with people whose behavior might be described as complex and challenging, those shadowing periods are really important. You know, it's important that individual gets to know their new staff and that the staff get to know that individual as well. So again, great, fascinating kind of indications, I think, around the cost. It's going to be different for every organization. I've spoken to some organizations that think it costs them slightly less than this, you know, talking about £2,500 to £3,000 per person. And I've spoken to some organisations that think it's cost them up to about £5,000 per person. And like you said, when you look at that, I don't know any organisations that are as small as 20 people. You know, often we're talking hundreds and thousands of staff. And if we are looking at that average, which I believe has gone up, I think it's around 36% on last figures that I've seen. When we look at that, 33% of thousands of staffing is totaling up to hundreds of thousands of pounds over numbers of years, which just kind of mind-blowing figures in an industry that it can sometimes feel kind of cash-strapped. You know, one of the first things that we need to get better at is stopping that loss, stopping being lost on this area. It'd be so much better if this is going into service provision, development, innovation, etc., etc.
Yeah, and the other thing that isn't calculated and is unquantifiable is whilst staff are picking up the slack for somebody who's in a probationary period, and while staff are doing the extra curricular activities on top of the normal day-to-day jobs, so when they're doing vetting of CVs and interviewing and taking people through induction training and everything else, it's actually adding a layer of stress to their lifestyle, you know, and that takes its toll on individuals. So it's not just about the cost that we can quantify and we can actually detail out, but it's the effect of time away from clients, you know, and the outcomes for those clients deteriorating slowly because there's this churn every 3-6 months. We're losing people. So yeah, it's obviously something that we established APB for because we were approached by many people who were struggling with this very problem. And like you mentioned, the cash-strapped industry, it's really crucial that where we can, we can help bring down that number of churn of staff.
Absolutely. There's always going to be some, but particularly now, kind of as the pandemic is kind of slowing down and the pingdemic has kind of taken over, I think it's a real challenge in health and social care, especially with November the 11th looming and the statutory position around vaccinations. So I think that's one of the reasons we want to do some of these mini videos, ads kind of leading with this, because this was part of our why we established APB, because we believe that leadership can have an impact in terms of retention, and it's going to be the start of a few videos from us, just sharing some of the kind of research and areas that we find interesting, that have been relevant, that have helped us build our course, and that help us with our kind of interactions with other businesses too.
Interesting. All right, Paddy. Well, thanks for your time and thanks for sharing.
Good to see you, Ads. See ya.
Bye-bye.
Bye.